Alright guys, so we'll quickly be looking at the Scedosporium species. Alright, so you can see this is a culture medium. This is how these guys grow like, right? Culture is how they grow like, okay? So they're actually what? A genus of the fungi in the family what? Microascaceae. Alright, so they are known to cause infections, particularly in immunocompromised people. When they say somebody is immunocompromised, what do they mean? That person, the immune system is already weak. Alright, so your immune system is already weak, so anything can now come and enter. Anything can now come and enter. You understand? So common species of this Scedosporium are we have the Scedosporium what apiospermum, also known as what um, Pseudallescheria boydii. All right, so it's actually the most common pathogen in humans. Then we have the Scedosporium what prolificans, which was probably also known as what Lomentospora prolificans, right? So one thing is it's good to always know these names because some of these organisms they still go by their former names, right? Still go by their former names. Okay, so habitats, where will you likely to find these guys? So they could be found in the soil, decaying plant material, organic matters, and all of that. The humans and animals, they can also colonize your skin and mucous membranes of what? Humans and animals. Okay. So infections. Which type of infections will these guys actually cause? So they can also cause what? Mycetomas, which are like chronic infections of the skin and subcutaneous tissue. Right. Then also invasive infections, right? In the lungs, central nervous system, the eyes, the ears, and other internal organs, right? So what are the risk factors? So immunocompromised individuals, like people who they are like their immune system is already weak. If your immune system is already weak, you have a possibility of having an infection from these guys more and more. Okay. So diagnosis is culture microscopy, right? Culture microscopy, right? So molecular techniques, right? DNA based methods, right? And all of that. So treatments use what? Antifungal drugs, amphotericin B, so it's not B3, it's B. Voriconazole can also help. So challenges is some of these guys can actually be resistant to treatment. Okay, some of these guys could actually be resistant to treatment. Okay, so this is for what? Scedosporium species.